All right, ladies and gentlemen, can you take your seats? We're going to start the meeting on the Joint Education Committee. Clerk will take a silent roll. Do we have a quorum? We do have a quorum. So first on the agenda is going to be accepting the minutes from the September 14th meeting. Recognize the co-chair for a motion.
I move that we approve the minutes from Tuesday, September 14th.
All right, motion has been moved. Any questions, additions, deletions? All in favor, say aye.
Aye.
Those opposed, nay. Ayes appear to have it. Ayes do have it. Motion adopted. First on the agenda, we have a proposed legislation imposing an eye exam requirement on children entering school. Dr. Laura Sipa, West Virginia Optometric Physicians Association. Welcome.
I'm Dr. Laura Supay, and I practice optometry here in Charleston. And most of you may have heard of this Children's Vision Act either in the Senate committee where we presented it in 2019, or in passing or walking around, we have spoken to some of the House members. So what this legislation would do would ensure that all children entering our state's public school system would receive an in-person comprehensive eye exam from an eye doctor to ensure they have the best chance to achieve. There's an excerpt from the bill on the slide here that kind of outlines what it would do. They do have until January 1st of their school year. It's not something that would keep them from entering school, but it would mimic the dental exams that they are required to get now. Why do we need this law? An estimated 1 in 5 children has a vision problem. School-based screenings are inadequate for catching a range of serious eye conditions that also mostly have health implications. There are lots of studies that have been done by both the state of Kentucky and the American Optometric Association that outline some of the reasons that have statistics along with them, like routine screenings provide less than 4% of the eye tests that we need in practice to help the children see, and they miss up to 75% of children with vision problems. When a vision problem is found, one study found that 61% of public school children who failed the screening do not receive any follow-up care, and 73% of children with eye and vision problems will pass the traditional vision screening that have amblyopia or a lazy eye when it is given in, say, a school or a pediatrician's office. Comprehensive eye exams are considered the highest standard of care when it comes to protecting eye and vision health and preparing for school success. Why early diagnosis is so important is during the first 12 months of life, infants begin to gain visual skills that are vital to their long-term development. Eye and vision disorders can be easily corrected if treatment begins early. And a child's eyes go through the most rapid changes during the first 6 years of life, a time when routine eye exams are critical to ensuring good vision for academic and life success. And early diagnosis of serious and potentially blinding disorders such as amblyopia can literally save a child's sight. Can the requirement of comprehensive eye exams for children lead to overprescribing of glasses? The answer is no. Comprehensive eye exams for children are critical to addressing the untreated amblyopia cases that can lead to blindness and problems which can lead to poor school performance and other issues that affect a person's overall quality of life and can increase cost to society. Again, a study from Kentucky found that under the comprehensive eye requirement that their state has, 13% of children required vision correction from a previously undiagnosed condition, and 3.4% were diagnosed with amblyopia, which is a lazy eye, and 2.3% were found to have strabismus, which is a crossed or a turned eye. Is it widely accepted that children need comprehensive eye exams before entering school? Yes. Evidence supports that all children should receive a comprehensive eye exam before beginning first grade. And research supporting AOA's evidence-based guideline, which was updated in 2017, recommends preschool-age children receive a comprehensive eye exam during their first year of life, between the ages of 3 and 5 and before entering first grade and annually thereafter. Other states have passed laws like this, the closest one being Kentucky. They also include Illinois and Nebraska, and some additional states have been adding this bill in their states fairly recently. This is picking up. In Nebraska, which now requires the comprehensive eye exams, an estimated 1 out of every 8 students had an eye problem that would not have been detected during a school-based screening. And states like Kentucky have seen no additional financial burden due to the legislation, and they are potentially alleviating the overall cost of undiagnosed vision problems, estimating $5.8 billion. Would kids getting a comprehensive eye exam raise healthcare costs? The reverse is true. Comprehensive eye exams do not put a heavy economic toll on the state. What it does is increase health care costs are untreated eye and vision problems. In most instances, insurances already cover the costs of comprehensive eye exams for children. And the financial burden on states is very small due to free programs and utilization of insurance. Based on an ADHD prevalence rate of 5.29%, also, the AOA has estimated annual comprehensive eye exams could reduce Medicaid and CHIP spending by $498 million annually. And according to the Kentucky Optometric Association, in the first 2 years of the state's program, the reserve fund that they established through their optometry association, separate from the state or from Medicaid, paid for only 141 total exams, and due to the lack of necessity, the state was able to eliminate the allocation. Are comprehensive eye exams expensive, and will parents be able to afford them? Federal law currently requires most health insurances plans to cover pediatric vision exams at little or no cost to the parent. Over the long term, comprehensive eye exams are far less expensive than the medical and social consequences of missed eye diseases and poor vision. And an estimated 70% of children affected are insured for comprehensive eye exams through private insurance or may otherwise be covered by Medicaid, CHIPS, or other state or federal programs. Also, optometrists, ophthalmologists, and local organizations such as Lions Clubs offer exams and care for discounted rates, and some provide care at no cost to the patient's family. National charity organizations also, such as Essilor's Changing Life Through Lenses program, also provide ongoing assistance for family in needs. So we believe that coupling this with the dental exams that they are currently receiving before they go into school will really help our state's children achieve the educational performance that we hope to have in West Virginia. Do we have any questions? And thank you all for letting us have these.
Let's see if there's any questions. Are there any questions? I will recognize the Vice Chair for a question.
Thank you, Madam Chair. Doctor, thanks for coming here today. So my first question has to do with some additional costs to this. So you're telling us that CHIP covers all eye exams for kids, right?
Yes, in the state of West Virginia, CHIPS covers the eye exam in full and $125 towards materials, which is the cost of glasses or contact lenses for the child.
Up to what age?
I guess until they are taken off the CHIPS program.
Which I think in this case is it's either 18 or 21, so it's not
21 is state Medicaid.
State
I believe
Medicaid.
CHIPS is the same because CHIPS is under Medicaid now.
Okay, thank you. Appreciate it.
Any further questions? Recognize, I forget,
Dr. Stallings.
Dr. Stallings, yeah. Senator Stallings.
Thank you. Thank you, and thanks for being here. The comprehensive eye exam, is that a dilated eye exam, or?
Yes, so it would be a full dilated eye exam in the office that they would need to come in for, like they do with the dental exam, to have that performed, and a form filled out like they do with the dental exam to take back to the school.
And as far as the workforce, again, West Virginia is a rural state, so we can mandate this exam.
We don't like
Can everyone get in to the provider? Does the provider workforce, is it enough to handle this onslaught, if you would?
We believe so. We do recognize that there are about 800 dentists in the state of West Virginia, and there are about 300 optometrists and about 150 ophthalmologists, which we do have a access map that we can provide for everyone if they'd like to see it. But we do believe that extending it past the beginning of school to the end of the first semester will help children get this done before they would be needing to have it done.
And this would be, I'm guessing the machinery needed to do this would be a doctor, or it would be an optometrist or an ophthalmologist office.
Yes.
You couldn't go on site and have.
We could. We haven't discussed setting that part of it up, but we do believe that if it seemed to become a burden, that would be something that could be done off-site with handheld, things that we could use outside of the office to provide still the screenings for eye turns and binocular vision problems and doing the dilated eye exam.
And currently, the exam is done, or the way we do it now, if you would, is just a in-school vision screen, just maybe an eye, like a Snellen's chart or something.
Most frequently, it's a chart on the end of a door at the end of a hallway. It does need to be at 20 feet or set up to the requirement of the size of the chart, which tends to be an issue. They're not always calibrated to check the vision accurately. We worry about a lot of times in school when they're lined up to do it, the child may hear what the answer is from the person in front of them and just memorize it. Or a lot of the times if it's a one-eye issue, they see it with one eye and then they just say the same thing for the other eye. And like this, I had a 6-year-old Friday actually that came in. The parents had no idea that he had one eye that was 20/20 normal and one eye that was very farsighted because he had been utilizing one eye and nobody had noticed.
Thank you.
Thank you.
Thank you. Are there any further questions for our guest? Oh, the Senator. Senator from Mason. Sorry, it's been too long since we had session.
Thank you, that's fine. Doctor, I have a question about providing these exams possibly at the schools. Right now, I know we have dentists that actually come to schools to provide care for students whose parents can't get them to different offices, things like that. That's something that I see at my school personally. So do you think that would be, how easy do you think it would be to have an optometrist come to, maybe not every school, but specifically maybe Title I schools or schools in a rural area where a lot of parents can't get their children to an optometrist? Do you think that would be a possibility to have something where they could bring it that's mobile, like the mobile dentist, a mobile optometrist?
We do believe we would have enough people volunteer to do, maybe in these rural areas, one kind of day of bring your children to the school to have this done for them. Also, I know in our case, my office is in Kanawha City here, and we worked with the social workers at Westside Middle and Capitol High School, and they had already a list of children that they knew of that needed care, and they brought them all to our office one day on the school bus, and we just saw like 15 kids in a row and helped them pick out glasses. And we did use, if they had a Medicaid benefit, we used their Medicaid benefit, and then if they did not, we used the SLOR's Changing Life Through Lenses program that I had been mentioned in the slides as a way to get, have all the equipment there without moving it. But it is mostly mobile things. The main thing is we just do hope or recommend that they have these at least done by the doctor at one point during the early school.
Thank you so much.
Thank you.
Thank you. Any further questions? Senator from the Putnam.
Thank you, Chairwoman. This is actually, I'm not sure if it's appropriate to ask a senator to yield in this meeting. Is that okay? No, I'd actually ask the senator from my co-senator, junior senator from the 4th, if you yield.
If it's okay with her, yes, she will yield.
Just curious, are the dental screens and dental treatments, are they mandated?
Mandated? I don't believe so. But I may be the wrong person to ask for that information.
Okay. I wasn't sure who else to ask, so that's the reason I asked.
The State Department of Education does require that they have a dental exam before entering school, and they have to have a form filled out and and turned into the school with their immunizations as well.
All right, thank you.
Thank you, Senator. Just so you know, there is someone from the State Department of Education if you did have further questions about that. Are there any further questions for our guest?
I would like to add, there is a very nice toolkit on the State Department website that we would like to, use as a format for what we are doing as well. If, for schools to utilize, if you go to the State Department website, they have a very good dental toolkit, and that's something we would, provide as well, using the State Board of Optometry recommendations.
Okay, thank you very much. It looks like we've exhausted all the questions. Thank you for being here.
Thank you all so much.
The next item on the agenda, we have a Chapter 18 and 18A work group update. I will first recognize the Vice Chair.
Thank you, Madam Chair. So first of all, if you remember, about 6 months ago, we passed a resolution creating this work group or a task force to look into Chapter 18 and 18A. It passed unanimously over in the House, and we've had a couple meetings about it. But this originated about 2 years ago. There was a group of us that got together to look at different things that were in these two chapters that were outdated or unnecessary. And our House Education Committee staff actually proposed a small cleanup this prior session that passed. It had 17 outdated code items that were eliminated. But there was still quite a bit in there that needs taken out. So here's what we've done so far. We did have a town hall at Capitol High School about a week and a half ago. About 100 or so educators and parents turned out and provided some really great input. Personally, I've gone around to about 7 different counties, met with superintendents, principals, different Board of Education members, and gotten really excellent feedback from all of them as to what we need to eliminate. But I will just say that most of the conversations we've had are not about outdated code. It's primarily relating to different complaints or concerns that these folks have about the current education system. They also provided a lot of good feedback on what we need to change, but not so much on feedback of the actual intent or the purpose of Chapter 18's task force. Some of the things that they also suggested are what not to do. What should we not eliminate? And the primary concerns that I heard from educators and service personnel were things like duty-free lunches, things like seniority, things like not changing anything about the grievance board processes. But like I said, we also got a lot of positive ideas. The most obvious thing was reducing class sizes, but of course there is a tremendous cost to that. But some smaller things as well that you wouldn't really expect, like eliminating some paperwork requirements for teacher planning time. That I learned quite a bit about that. Eliminating trade school caps in areas like Kanawha County. But my priority is actually Article 5. And I did want to recognize Dr. Howard O'Call. He's somewhere here, if he could raise his hand. Right back there. This week, he's going to come out with a report from the School Board Association outlining some of the possible ways to reform Article 5, as well as some of the history behind the creation of that article. But that has to do primarily with the creation of these county boards of education. They used to be based on magistrate districts a long time ago, but today, of course, every single county has an independent board of education. Clay County, with 7,000 people, has the same number of Board of Education members as Kanawha County, with 170,000. So there are some discrepancies in that, and the possibility of reforming Article 5 has probably been the most common conversation that I've had with people in some of the conversations that we've had the last few months with this task force. And that is something that the legislature can look at doing this next legislative session, but more than likely it'll take a couple of sessions to try to update. But in the future, we are going to send out a survey monkey to all of the different associations, to the different teacher and service personnel groups. We're going to send it out to the School Board Association, just asking for input, asking for ideas for this task force. And then finally, we're going to continue having some public town halls. Delegate Hornbuckle has been gracious enough to help us organize one in Huntington in November, but we're going to continue doing that in the coming months, and really looking forward to coming up with good ideas.
Thank you. Before we open up to questions, I will have the senator from Raleigh give his report.
Thank you, Madam Chair. It has been a lively summer. I've been at 3 town halls and listened to a lot of people and been talking to a lot of people. I probably have some 60 items from those different town halls that we've conducted that are areas of concern. Just to be a little bit specific, there's some concerns about SB 359 in 2013, Policy 5000 that needs to be reworked, fixing some seniority rather in that. Also, there was some concern about, I think it's Federal Policy 2419, dealing with some autism and providers outside not being allowed to help the autistic children. There's some issues I think that some had mentioned, especially with special ed, that they were very concerned about. Policy 2419 with some concerns there, and some better services that would be allowed to be made available for special education teachers and parents. Obviously, funding is something that came up. There's some concerns that some had with transparency in curriculum and the question marks there. The topic of critical race theory did come up, and the concerns that such would not be being taught, and I know folks have denied that that is happening. There's a lot of fear out there among the teachers dealing with 18 and 18A, and they fear repercussions if they say something. I don't understand that realm of existence, so I can't comment on that too much other than to say that it is real to them, and they are very concerned. And so sometimes the town hall situation is rather difficult to deal with and to get correct information or the best information out and have the best discussions. I've found that when we do these town halls, and I would encourage you if you ever do one, to always make sure that you allow plenty of time after the town hall, because you'll find more information out after that and have the personal meetings. And people want to talk. They have their opinions. And obviously, no system is perfect. I was rather disappointed in some of the speakers at some of the town halls. I had to listen to an hour of ranting and raving over the past, which was of no value whatsoever, but it was all directed toward the legislature. And to me, it just doesn't make sense as a legislator. We set these things up. We take our own time, our own dime, and we are trying to engage and make things better, and then still get trashed. And I don't do it, but I'll just say it here in this context, that somebody needs to start becoming the adult in the behavior of the whole situation. We're trying to, as a legislature, and trying to work together. But it is extremely frustrating when we have associations that represent teachers and service personnel that scream and holler and act totally out of control. And that may get them some attention, but I want educators to understand that it gets them nowhere. We don't advance the program. And so I would encourage those who are paying attention to this committee and the desires of this legislation, this resolution, that you would come to the table and talk, not shout and holler and attack. And I think things would help. That would go a long way. I think certainly whatever we can do, the teachers are concerned about keeping the duty-free lunches. I don't know, I never had a conversation about getting rid of duty-free lunches. I don't think we've had any in the legislature, but somebody spread that rumor, and then all of a sudden it gets thrown in our face. And we're not trying to hurt teachers. We're trying to help teachers, because to help teachers is going to help the students. And we're trying to deal with a system that is very cumbersome and difficult at times. I think probably the loudest thing that I brought from all of those town halls that I've been in is the fact that teachers are absolutely frustrated with interruptions. They are forever being interrupted by this, that, and the other, and they just want to teach. And it's everything in the world, that all of the different testing requirements, all of the other things, they just feel overburdened there. And so as you discuss this among others, I encourage you, see if this is a real problem and what the solution is. I'm withholding any kind of judgment or decisions on anything, but there's several that have been discussing that kind of a problem, and we want our education academics to improve. But if these teachers keep having to leave their classes or stop their classes so that they can focus on this because somebody in central office they're running a survey, or they're trying to figure out, trying to analyze. Well, I think it'd be a wonderful thing if we just let the teachers do their thing in the classroom. And I don't know if the legislature is part of that, but I would sure like to have that question answered by some folks. What can we do to give the teachers more time in the time that we've allotted for them to teach and share their academics? So I think you probably have a good handle on the idea that I have a whole lot of things that folks have presented. And what we can do, we'll have further meetings and we'll have further discussions. But so far it's moving right along. And I commend the House for the presentation of the resolution. I find that many of the educators haven't even read the resolution. They don't even know why we're meeting, and they sense it as some sort of an attack, and that is very unfortunate. So it's just the way it is. But we'll keep plowing on and hopefully have some good and some legitimate presentations to give to this body by the time we get into December. Thank you very much.
Thank you, Senator. Are there any questions? And I believe that the Vice Chair has a little additional update he forgot to add to his presentation.
Yeah, I wanted to mention something that Delegate Clark brought to my attention. On October 25th, there's going to be a town hall in Jefferson County. I believe he's passed out some of these forms or flyers. It's in Kearneysville, West Virginia, 6:30 p.m., October 25th. So that is, he just wanted me to remind everyone of that event. So, but again, happy to take questions.
Any questions? Delegate Hannah.
Yes. To Vice Chairman Higginbotham, it may be too early for you to actually answer this, but when we get into session and start introducing these bills, I'm guessing it is bills plural, and the outdated code that we're removing will be separate from the Chapter 5 reform. These will be separate bills, correct?
Yeah, definitely the Article 5 reform will be separate. If Dave is here, our policy analyst, he was the one who wrote the small repeal that I mentioned earlier for this prior session. And I believe those were all in different sections, but they were in one bill. So hypothetically, we could do the elimination of outdated code all in one bill, I think. But yeah, the Article 5 reform would have to be completely separate.
Okay, yeah, because my main objective when we pass this resolution is just repealing outdated code and getting that stuff out of there. So I'd just like to be able to vote on that separately from our reformations. So just a suggestion. Thank you.
Thank you, Delegate. Are there any other questions? Delegate Kelly? Stadler, sorry.
That's fine. My question would be addressed to the two co-chairs. Any code that has been brought before you at this point in time, asking us to look at it, if you would share that with the full committee's numbers so we can do some research on those areas before our next meeting.
Yeah, sure.
Thank you.
Thank you, Delegate. Any further questions or suggestions? Delegate Walker.
Thank you, Madam Chair. I know these meetings are not being recorded, and I know that there's a lot of turmoil and a lot of anxiety and a lot of frustration. For nothing else, this is a way that we can uplift the educators by listening. And sometimes it's hard to listen when people are passionate. These professionals, whether they are cleaning a restroom, whether they are providing transportation to these children who are dealing with all kinds of things, I'm sure they get screamed and hollered at day in and day out. But they go back each and every day to educate our children. So as we're doing these town halls, and I attended one with Delegate Higginbotham and Delegate Tully and Delegate Hannah, and we listened. And it is hard when someone is steadily speaking about your colleagues and in a place where you were elected. But it is part of our job also, as they are our constituents. Just as we have healthy debate in committees, they don't get to see that because they're in the classroom with these children while we are in session. So they are coming to after our meetings to voice their true concerns. I just think that as you go to these town hall meetings, take a breath. Let them voice. And as the senator said, allow them extra time after those meetings. Thank you.
Thank you, Delegate. Any further questions or suggestions from the committee? Okay, well, thank you all. The final item on the agenda is an update on CARES Fund from the State Department of Education. Yes. Please introduce yourself before you start.
Good afternoon. My name is Melanie Perkey, and I am the Federal Programs Officer for the West Virginia Department of Education. And I'm here to talk to you about the coronavirus relief funding that we have received since March of 2020. And I think everyone has one of the booklets we sent over. Yeah, probably extras just in case. Because that is, I'm going to speak from this booklet and go through each piece of this because there's a lot of funding that has been received and there are a lot of strings tied to that funding. I'll try to explain it and then answer any questions that you would have. The first thing I want to start with is the fact that we often hear people refer to the CARES funding. And I think a lot of times they think that's all of the federal funding that we've received for the coronavirus. But the funding that we've received has come in three very separate and specific federal pieces of legislation. So I have broken that down in the booklet for each different piece of legislation and the time frame that it covers. So first I will talk about the CARES Act that was passed in March of 2020, right after the federal declaration of emergency was declared. Congress passed the CARES Act and it had a lot of different pieces. The piece specifically that deals with education was the Education Stabilization Fund, part of the CARES Act. And there were three pots of funding that came to states from that. That was the governor's emergency funding that we refer to as GEAR. the elementary and secondary school emergency education funding, which we refer to as ESSER, and then the higher education. So basically, they funded the 3 different entities in the state to address, in the language of the legislation, to do anything that's needed to prevent, prepare for, or respond to coronavirus. And that funding is going to be available to the state to pay for expenses that incurred back to March the 13th, 2020, when the declaration of emergency declaration was declared, and it will be available to the state until September 30th of 2022. So they gave us the ability to go back and reimburse for expenses that occurred prior to the passing of the act. The West Virginia Department of Education specifically received funding from the CARES Act. We received funding from the governor's office through the GEAR, and the specific things that we used that funding for were related to, we received about $9.9 million of the GEAR fund. We used a little over $2 million to shore up the virtual school, West Virginia virtual school system for the 2021 school year, because we knew that we would have many more students on that system than we have ever had in the past, and that is a system that is a per student cost. So we used that funding to make sure that we could cover the cost of all of the additional students that were coming into the virtual school system for that school year. The Communities in Schools expansion, what we heard from school systems in the spring of 2020 when they first shut down schools is that those schools that had communities and schools coordinators at the school level, they were instrumental in being able to check on students, make sure that they were putting eyes on students, talking with families about their needs and so forth, while teachers were busy trying to keep up with lessons and packets and keep instruction going. Those communities and school staff were trying to help families and find out what the needs of families were so that we could make sure that food issues were taken care of and other types of services that students would normally have received had they come to school. Those communities and schools individuals were instrumental. So we did receive funding, about $3.7 million of the GEAR funding, to expand that into additional schools across the state. I think we now have 31 counties and over 150 schools that have communities and schools liaisons. We also received some GEAR funding to provide to non-public schools. There was funding in the ESSER that county school systems were required to provide services to non-public schools for COVID relief. But there were about 4 federal legislation or 4 federal court cases that were holding up the ability of county school systems to start those services. So the governor offered through the GEAR funding to give us the money so that the public schools could have those services and supports at the beginning of the 21 school year. So you can see $1.8 million was of the GEAR money was used to provide services to non-public schools that requested them. And then the extracurricular emergency fund was $2 million. And that was to provide funding to school systems to support their extracurricular activities, because if you remember in 2021 and continuing, there are additional mitigation strategies that were required, additional PPE and so forth, that school systems had to provide for their extracurricular activities to continue. And they also had the loss of means to raise the funds that they would normally support those activities. So we asked for some GEAR funding, and we had matching funding from other state resources that we were able to give each high school in the state some funds to support those extracurricular activities so that students, as they came back in the spring, were able to continue those very important supportive activities. The bigger pot that we provided to schools was from the ESSER, the Elementary and Secondary Schools Emergency Relief Fund. In that first round in March of 2020, or in May, the West Virginia Department of Education received $86 million, $86.6 million. And you can see on page 3 the bullets of all the uses of that fund. And again, we always go back to the original purpose is to prevent, prepare for, and respond to COVID. So as you read those bullets underneath, you always have to say, go back to, it relates to COVID. But they could use it on a myriad of things that they might have needed or might have already paid for. They could be reimbursed for expenses that they had had back to March the 13th. And that particular fund, the ESSER fund, the law, and through each succession, the law has been the same. 90% of the funds that the state receive have to be allocated to our local school districts based on the their proportion of Title I funds received in the previous year. So Title I funds are allocated based on poverty. So basically, we look at our Title I allocations, and whatever percentage of the state's Title I allocation that school system received, that they will receive that same proportion of the ESSER funding, out of 90% of the money. In the first round under CARES, the state could retain 10% of the funding for state-level activities. So if you go to page 4 and 5, you can see a spreadsheet there that sort of outlines the specific amounts that were allocated to each county, and I will go across from left to right to talk about those. The first column is the formula funding. That is the 90% of the dollars, and that is based on the calculation of they received the same proportion of this money that they received of Title I money in the previous school year. The competitive column, we took the largest portion of our state activity, that 10% that we were allowed to keep for state-level activities, and we allocated that out for competitive grants, and we had 3 priority areas. One was educational technology, because we knew that was going to be an issue moving into the school year with remote learning. The second was social emotional supports for students. And the third was anything else related to recovery of learning loss. And you can see the counties that receive funding from ESSER. We had 50 counties apply for that. All 50 received money. We did target, we had state money that we could use for some of the items, and then we had this ESSER money. So we combined pots of money to be able to fund every county's competitive application, but the counties that are listed in this spreadsheet are the ones that actually receive the funding from the CARES ESSER funding. In the third column there with numbers, you will have to go to the bottom, the state activity. That will tell you what we spent the remainder of our state activity, 10%. One big item was the Kids Connect, if you remember, putting the internet accessibility spots at every school, library, higher ed, lots of public places around the state so that families could go there and get internet connectivity. The equipment and the installation of those we paid for out of the state activity. The administrative money, that is what money was left. If an actual expense comes up or another activity, we can put it toward that. We put no staff on this money. The only administrative thing we've done on this first round of money was to pay for travel of staff that went out and supported vaccine clinics. So we did have had some travel on that money, but other than that, that $200,000 is just what has not been budgeted for other activities at this point. From the governor's money, you can see the communities and schools, which counties received the $3.7 million. And you can see from the extracurricular activity money, which counties received that from GEAR money. Note that every county and every public or private high school in the state did receive the extracurricular activity money. I will say, and this applies to all of these, there's an application process that districts have to go through, or any other entity that receives this funding. And basically what they have to do is show us how they intend to spend the money, and then we have to approve their applications based on making sure that everything they've budgeted is part of that allowable expense. So if they put something in their application that doesn't match the bullets, then we can't approve their application. But it's not an approval based on our liking or disliking, it's just whether or not they have opted to choose to do allowable expenses on this money. They do also have the ability to revise an application. So what we have learned as we've gone through the pandemic is that, what we may have thought we needed when we submitted an application in May of 2020, if we have funds that we haven't spent, we no longer need what we budgeted. So they can always submit a revision to us and ask us to move money to something else, because the time has changed and what they've learned is they need something different. So next, we started the 2021 school year, and toward the end of that year in December, Congress passes another coronavirus relief fund, and that was the Coronavirus Response and Relief Supplemental Appropriation, we refer to as CARISA. And in that fund, it passed on December the 27th, and the state received funding in March of that year, and you can see we added some new funding streams. So we still had the GEAR, the governor's money, we still had the elementary and secondary money, we still had higher ed. We now added the emergency assistance to non-public schools. I mentioned those court cases that occurred that held up the money in the first round. Congress decided to just put their money in its own pot, so we didn't have to deal with the court issues, and the Department of Education did not appeal, so we could move on, and they just put the next rounds of funding for private schools or non-public schools in their own program area. And we also received some child nutrition funds from that particular pot. For the ESSER funds, we received $339 million in that second round. All of the uses of funds remain the same. However, in their guidance that they put out, they did emphasize in the second round the use of funds for improving ventilation. So that brought about HVAC upgrades and installation repairs, doors and windows, and those sorts of things became very popular in the second round of funding with ESSER. Let me make sure I'm not forgetting anything. The expenses for the second round, for this Carissa round, could again go back to March the 13th of 2020, but the funds are available to us until September 30 of 2023. So we have an extra year on this second round of funding. And if you can see again on page 6 and 7, the uses for ESSER are approximately the same. Like I said, the guidance did accentuate the use of funds for ventilation and other types of things that schools may need. We received the Carissa Emergency Assistance to Non-Public Schools as its own program funding. We issue invitations to non-public schools to apply for that funding. There are certain things, as you can see in the list on page 7, there are certain things that we could reimburse them for, like purchasing PPE and those sorts of things, but there are some other items that they want that we can only provide services. So we have to actually purchase services for them. And that goes to the issue of they don't want non-public schools to be actual recipients of funds, of federal funds, and the schools themselves don't want to be recipients of the federal funds. So in this case, the state remains the recipient, and we either provide the services to the non-public schools or we reimburse them for items that they've had to purchase. And then the last program that we received funding there was the Child Nutrition Emergency Management Operations Program funding that was provided because with school closures from March of 2020 to June, many schools did not get the reimbursement that they typically would have gotten had schools been open. And their programs rely on that reimbursement for operation expenses. So in this round of funding, Congress opted to sort of backfill the administrative funding that those schools would have gotten had they been reimbursed at the same rates that they were in the 2020 school or 2019 school year. So that provided funding for those school systems that might have lost funding because of lower reimbursement rates. And there you can see I've broken these out on pages 8 and 9. From the Carissa ESSER Fund, you have the formula, which was done exactly the way it was in the first round, based on their proportion of Title I funds. The second is Summer Soul. We opted as a state with the state activity money from this round, the 10% of that money, to focus on robust summer programs, because at the time this funding came out in March, we felt like by summer we're going to be in a better place and kids are going to be able to be back engaged in school pretty regularly, and we wanted school systems to have sufficient funds to do robust summer programs where they provided programs for all kids, not just remediation. We tend to have, on standard years, lots of remedial programs in the summer, but we wanted enrichment. We wanted programs that just got kids back in school and engaged in socialization with other students. So we provided significant funds. We put $33 million into this pot of money to allow them to provide the transportation and the meals and provide extra support staff, so they would have counselors and social workers and others there to get kids back engaged in school during the summer before the new school year started. Any funds that they have left that they did not spend last summer remain in that extended learning status, so they can use them for after-school programs or for additional summer programs next year. They can use it clear up till the summer of 2023. The state activity dollars that we had from that were not expended in the Summer Soul program were all provided to our non-traditional public schools. And when I say that, I'm talking about our School for the Deaf and Blind, our multi-county vocational centers, we provided summer soul grants to them because we heard lots of issues with students who were not getting the hours for their vocational certifications. So we provided funding for the multi-county centers to have summer programs so that students could get in there and finish their hours for certification. The schools for diversion and transition, we also provided funding to them. And you can see a small amount of administrative costs there. We did hire a coordinator to coordinate the summer soul because we were making a $33 million investment in summer programs, and we wanted to make sure that we provided all the support we could to the districts to get those planned and organized in a very short period of time from March till school was out in June. And then the last is the child nutrition, and that is, you can see the school nutrition programs, and then the second column, the CACFP, is the child and adult care facility programs. So the funding for those programs went to both school systems, and they also went to all of the other sponsors that do feeding programs through our child nutrition program. So you can see when it says other sponsors in those two columns, those are sponsors that are not county school systems. Okay, so then the third pot, right on the heels of Carissa, Congress passed the American Rescue Plan. And I forgot the date to put the date in there. They passed that on March the 11th, 2021. So less than 3 months after the Carissa, they passed this last round. And lo and behold, we had all the same programs we had in the second, and we added some more. So we still have the gear. We received the ESSER, the higher ed, and then we received an ARP version of the emergency assistance to non-public schools. And we added 2 additional. They gave us ARP supplemental funding for IDEA, for the Individuals with Disabilities Education Act, and they gave us supplemental funding for homeless students, for homeless children and youth. So with the ARP ESSER, we received $761 million. That program did have some requirements that were not on previous programs. Again, the 90% had to be allocated based on their proportion of Title I funds. Of that 90%, school systems had to allocate 20% of those funds for activities related to regaining loss in learning. But all of the other uses of funding applied to the rest of the money. And then on the state money, we had the state activity 10%, but we had restrictions. 5% of the money we had to spend on activities for learning loss, 1% on summer programs, and 1% on after school. We felt good about that because we felt like we were ahead of the game because we already dedicated so much of our state activity in the second round. We already knew summer was going to be important to us. What we opted to do in that round then was to provide 97% straight to the counties. So we gave them the 90% that they got in their allocation and their proportion of Title I money, and the 7%, the 5% for learning loss, 1 for summer and 1 for after school, we provided that in an allocation based on enrollment. So we just, your proportion of enrollment for students, you receive that portion, and then they have to spend those on activities for learning loss, summer, and after school. The 3% of the remaining activities, I'll detail that when we get into the spreadsheet. But you can see there on page 11, the ARP IDEA, that is strictly supplemental for the IDEA program. So all of the rules of the IDEA program apply to that funding. It's just additional money to meet the needs of students with disabilities. The ARP homeless children and youth money, we received a little less than $5 million for that program. And that's a program where 75% of that has to go out to the districts. And half of it goes in a formula based on their, a mix of their Title I proportion, so a mix of poverty, and then a mix of their homeless student count, because we have a count of those students every year. The 25% of it stays for state activities, and it's focused on coordinating at the state level with community-based organizations that serve homeless students to make sure that they're getting wraparound services, that they're getting those services from the community that help them with the stabilization that they need for their education. And then again, we received another part of the emergency assistance to non-public schools. That was $9.7 million this time. And on this round, we can only provide services. So we can no longer reimburse the schools directly on this round. I think Congress felt like with the other rounds that we had probably reimbursed past expenses moving forward, they have to request the supplies and services that they need, and they have to be purchased by the state. So you can see then the spreadsheet starts on page 12. You can see the formula funding for the ARP ESSER that went to the county school systems. And I said on page 14, that second column, the state activities, again, we shored up our non-traditional public schools, so our multi-county vocational centers, our School for the Deaf and Blind, and our schools for transition and diversion. They all received a portion of this money. And this money also was strongly focused on, from the federal guidance level, on the fact that you could do ventilation, remodeling of schools as long as it related to issues that would prevent, respond, and prepare for COVID. So those schools also received a portion of this money so they could do the same. We also put money in a statewide technical assistance center for STEAM, for science, technology, engineering, arts, and math. And that technical assistance center will serve all of the schools in the state and help teachers and students promote STEAM activities, and that amount of money will carry them for 3 years to establish that technical assistance center. We also put money in a technical assistance center for student support to address those social emotional needs. And again, that is to assist and build capacity to help schools as they bring on more communities and schools and more professional support staff to assist with students' social, emotional, and physical health needs. The teacher in residence program, because one of the things that we've heard over and over from school systems is the shortage. They have all this money to hire new additional staff, and the shortage, they can't fill positions. So we put some money into those teacher in residency stipends to help draw our teachers who are getting ready to do student teaching, to be able to get them to stay in our school systems and be able to utilize them as they're being student teachers to help with some of our shortage areas with substitutes. The WEVIS updates, the website contract, and the virtual schools revamp are all related to technology expenses, either to improve our instructional programs and the delivery of those virtually, or the safety issues and so forth, using our WEVIS and our platforms to do that. And then you can see what the counties would receive going back to page 12, each county what they would receive from the homeless education. That's their formula. There will be a component of the homeless that's required to be competitive. We have to put $2.1 million out into the competitive application process, so counties will have to do a competitive application and try to get that. We have enough funding. We will probably fund about 18 counties at $50,000 or so, depending on what their requests come in at. That would be on top of their formula. So those are for counties with really shelters and high numbers of homeless students that would have need for additional money. The IDEA, that comes in two portions. It comes in the school aid portion and in the preschool portion. And those calculations are done exactly the way they are with our regular IDEA funding. And then you can see on 15 and 16 and 17, you have the summary. So we've added all of those up, so you get the total. And I will say there, I just caught as I was sitting over there earlier, because the gear that we received for virtual schools and for non-public schools was not broken out. It was not in that total. And the two emergency assistance to non-public schools we didn't break out because they didn't go to counties. So really the total is $1,243,380,057 that we have received and administered. And on the last page, I will draw your attention to this because this is one of the things that keeps me up at night when I think about dealing with this money until 2024. There is a requirement for states that receive this funding to comply with what they call maintenance of effort. And that is that maintenance of effort requirement falls on us at the state level, that we continue and maintain our funding to public schools at the same level as pre-pandemic. So, we cannot reduce funding to our public school systems from state and local monies as long as we have this money. And if we do, then we will be in non-compliance and have to work through that issue of possibly having to refund some of the money. So we're always looking at that issue as well. And you can see the rules change a little bit for each one of the pots of money on how they expect us to comply with that maintenance of effort rule. Okay, I think that's covered it. Questions?
Thank you. I'm sure there will be. I'll start off with a question. So can you just go over a little bit, because you told us about the competitive funding and them, there having to be applications, but what transparency or accountability did you guys set up for these funds so that you know the money was used appropriately?
Okay, so for each pot of money, even the formula funding, they have to submit an application. We review the applications, and we have an application platform that once an application is approved, it's available to the public. It's WVDE GPS, it stands for Grants Planning System. And basically they have to, we line up, these are all the uses of the funding, and they tell us what they want to do under each funding source and how much money they're going to allocate to that. And then in the budget, they get very detailed with object and function codes so that we can track that money as they spend it through the finance system. And then, as I said, if let's say in the first round they put a lot of money in sanitization products and now they don't need that, they can certainly, you know, go into the system and say, I want to do a revision and take the $100,000 that I was going to buy cleaning supplies with and do something else with it. They can do that, clear up through the life of the grant funding.
Okay, thank you. Other questions? Senator from Oregon.
Thank you, Madam Chairman. And thank you, Melanie, for that presentation. I just have a question about the maintenance of effort. I'm kind of reading the way you have it written there on page 18, and it's maintain state support. I'm talking about public ed. It says at least at the proportional level of the state's support. So here's my question. It's just a math question. Our state aid formula is driven by enrollment. County levy money's not so much. It's driven by what the property's worth in the county. Have you guys worked through that? In other words, if we don't amend our formula, if we fund as we have, even though it may be a declining number because the enrollment's been going down, are we okay?
I work very closely with Amy Willard on this, and you know, we're always looking at what's going to happen. And there was new guidance that recently came out because states did make that complaint. Many states, you know, our funding formulas are based on enrollment, so if enrollment is going down, that number is going to go down. They have revised guidance that also allows us to use some other monies that go into the system to count for that, and they have offered a waiver process. So if we get to that point and we can meet all of the if we get to the point where we're not quite at the proportional level, but we can do a good explanation of why, and in a waiver process, they will entertain waivers.
Okay, thanks.
So sort of a year by year. At this point, all of the data that we've sent in, the baseline data and this first year data, we're okay.
All right, very good. Thank you.
Further questions? Senator from Putnam.
Thank you, Madam Chair. What other items, aside from enrollment, you said that they said you could also use other appropriations to count for that instead of enrollment?
Okay, so while they say the state funding for it, we can also include the local share. We can include categorical funding like the state's funding for IDEA or for special education and for other pots of funding that you provide outside of the formula.
Do you recall for the funding that you used for that, how much that totaled?
No, I'm sorry. I could work with Amy and we could get that to you.
Okay, thanks. Because I know there's a student population drop, and I'm just curious about what that pool of money is that can offset it.
Thank you, Senator. Delegate Statler.
First, let me thank you for this booklet. It's very informative, and I appreciate that getting us out to us. My question is, looking through this, have we any type of evaluation system? This has been an ongoing process now for quite a while, and what the outcomes are, because we're putting the money out there. A little concerned as to whether the outcomes is what we want them to be, because there's still a lot of frustration out there with the teachers and parents and everybody else as to whether these students are getting the educational system that they need to get at this point in time. And I don't know if that is as much of a question to you as, are we looking at that?
Yes, we do. And, I will sort of take this incrementally. In the first round, we are required to monitor their use of these funds. So we have to make sure that they're compliant with all of the rules of the funds. In the first round, the majority of the funds were allocated to technology. As in March, April, May, we were worried about all the remote learning and the students, how were they going to access remote learning? So a lot of that money was dedicated to buying devices, buying the software and the platforms that counties are using for remote learning, and making sure that they had ways for internet connectivity as much as they could. So, obviously, the accountability for that is your inventory. Do you have the devices that you purchased, and so forth. The second round of funding was used a lot for payroll, because one of the things they can use it for is continuity of operations and actually keeping people employed or employing additional people. That payroll was in several different forms. Hiring new people if they could. A lot of it went to substitute costs. A lot of it went to paying teachers for covering classes on their planning and lunch periods so that when they don't have substitutes. A lot of it went to leave. The cost of that, because this money could be used for COVID-related leave and so forth. And then some of it went for payroll for the coming year, because at the time they were going through personnel season and would have had to RIF folks, they had no idea what they were looking at for enrollment coming this fall with virtual students be coming back and so forth. So a lot of them opted not to RIF teachers last spring. And they knew they would just use this funding to keep the salary for those, even if they were not in their formula money for this coming school year. So a lot of that money is tied up in payroll. So obviously, what we'll be looking at is did you actually keep those people on, and were you able to fill positions and so forth. The Summer Soul is the first pot that we designated that had to be related to learning. And we do have an evaluation project. The first reports are due in from the counties on October the 15th, so they're due later this week to see, just to look at when kids were leaving school and then they had the summer program, did we see any difference in students that participated in the summer program when they came back in their baseline data this fall? Were they more prepared to be starting in the next grade level and adjusting to being back in school? So we do have those types of, both from a learning standpoint, looking at assessment data and other types of learning reports from counties, but then from the standpoint of those kinds of expenses of just inventory, what did you buy with this? We do have to keep track of that too.
Yeah, I believe that you guys have done adequate job looking at how the money's going out there and whether it's being used properly. I don't have any question that. My question is more detailed, and I don't know how to ask it other than, are we hitting the mark with the students? Because for all intent and purposes, the last 2 years, the students has not had a school year that was conducive to education. So all this money that we spent, can we say that our students are on the level that they should have been had the pandemic never happened, or even close to it?
At this point in time, I would say the only data set we have is the statewide assessment that was done in the spring. And I don't know if they've had a presentation on that data, but we did see drops, and we expected to see drops. And we're working on the idea of what will the accountability system look like for that catch-up, and how will we work with schools to, obviously they're not going to jump right back up there in a year, but how can we push the envelope to get them back in incremental steps within a year or two.
And one last question. You mentioned technology, and I commend you on working with that. Have you any way of assessing the students that's in the outlying areas, the rural areas, as to, and most of them didn't have any access to the internet whatsoever, and I know that our county and several counties, I'd say all counties, created what they called hotspots. But that also created issues to the students that their parents chose not to take them to the hotspots, or they just couldn't get to the hotspots. Have we looked at other ways of creating a better system that would go over and above the hotspots, so now they can do it at home? So in other words, are we putting more money into the home technologies?
Yes, both in that first and second rounds. Counties, I've talked with superintendents who've had their staff going out everywhere in the county. If they could find a signal to have a MiFi, they have paid for individual MiFis for students, so they would have that at home to get the internet at home. And they supplied many students with that internet option. They also, if they could pay the internet provider in the community that have provided that, they could pay that, and they have used some of these funds for that. And then there are just the group of people who live in places that it doesn't matter what we could pay for or provide. There's no service that can get them that internet. And those are the ones that we still have not been able to figure out, except for trying to have these platforms where they can download a lot of the work and not have to do it all online. So they don't have to be online the whole time they're working on their school work. They can download it when they're at school, or go to the hotspot and download all of it and be able to do it all. But there are places in the state that we just still cannot figure out how to get internet service there.
Thank you. Thank you, Madam Chair.
Thank you, Delegate. I recognize the Vice Chair for a question.
Thank you, Madam Chair. And this is a really, really great report. It answered a lot of my questions already. But I wanted to ask a hypothetical question, if we could, since there's going to be several more years of spending this money. Social distancing is one of the parameters that we're allowed to use this money for. So, again, hypothetically, could you use this money to, or the counties, to reduce class sizes for the purpose of social distancing?
Yes, and counties have done that. Okay. For the social distancing, just to give some examples, you could reduce class size, so you could hire more staff to have smaller numbers of students with teachers. You could remodel space that's not currently being used as a classroom to create more classrooms if that's an issue. If you don't have enough rooms to divide them out, you could use this money for remodeling and creating space. You could use it to lease additional space.
Yeah. So long term, I think the legislature has certainly said, and everyone that I've spoken with agrees, that we need to reduce class sizes, and that is the best way to achieve better student outcomes. So is the department actually pushing counties to, or encouraging counties to use the funding for that purpose, or is it more of just a laissez-faire, use it as you see fit kind of approach?
Our initial push was for them to think about students' needs and the people that they need, probably more so than the things or the stuff that they need. Obviously, a lot of the changes, counties, maybe wanted to reduce class size, and they posted positions and couldn't fill positions. So some of them backed up and they thought, well, maybe they hired more service personnel, aides, instructional aides, and others, so that there were more adults in the classroom to help students with their individual needs. So a lot of it has changed based on the availability of personnel to fill some of the positions. But most of them started out, at least in elementaries, trying to get smaller class sizes. And started out with, can we hire more teachers? And if we couldn't get more teachers to fill those positions, some of them have moved to looking at more instructional aides and other support personnel to just create more adults in the room to help students individually and in small groups.
Thank you. Thank you, Madam Chair.
Thank you. Delegate Hannah.
Thank you, Madam Chairwoman, and thank you, Ms. Perkey, for being here. Just one question. Were schools or counties given any funding in return for mandating masks or having COVID vaccination clinics?
No, that's an option. They're required to have, on the American Rescue Plan, that was the first round of funding, where they were required to post their reentry plans. So they have to publicly post their reentry plans, and they have to address the mitigation strategies that CDC puts out, but it does not require what their strategy needs to be. Their reentry plan just has to address all of those strategies.
Okay, thank you.
Thank you. Delegate Evans.
Thank you, Madam Chairman. Thank you for being here. Your document is phenomenal. I'm amazed at the summative numbers. That's a tremendous amount of money that came in the state of West Virginia that obviously can be used to better the education here. I do have a couple of questions. One of the things that I heard from many teachers on the virtual was that the kids weren't signing on, and the parents couldn't help them sign on. Was there any training that was done for parents, or any ongoing training in case we would need that? I know in our county we've had to shut down a couple of times individual schools because we had sick teachers and quarantined staff, and we simply didn't have the substitutes to cover. Is there any training that's going on currently?
Yes, counties can use this funding to train. They used a lot of the funding in the first 2 rounds to train staff on these new platforms that they purchased. A lot of counties also repurposed some positions that they had in the county. They had technology integration specialists that were dispatched to be available to parents. I've had counties that talk to me about, people that they would send out to the home and sit on the porch with parents or grandparents that were trying to help the students to figure out how to log on to the systems. So they provided both telephone support, they provided home visit support. They also provided evening tutoring support virtually, so that they paid teachers with this funding to an hourly rate in the evening to be available remotely for parents when they were not at work to be able to help them.
I was concerned by one of your statements that the only data we have is the summative assessment. We're talking about a tremendous amount of investment to make sure that our kids are doing better. Is there any data on like attendance or other things like that because that just a summative assessment's all we have. Certainly we have more.
Yes, and when the gentleman asked the question, I interpreted the question, he was asking about any data that we have on how students are doing academically. So academically, the state level data that we have right now is the summative assessment that we did in the spring. We did not have a summative assessment in 2020. But the school systems have other assessments that they use throughout the school year to get more periodic data, but we do not collect that at the state level. But yes, we do have attendance data, and we have behavior data. We have other data that's collected in our system for last year. I will tell you that we have some concerns about the attendance data because of the craziness of how you took attendance last year when students were remote, and that whole issue of do you count them as absent if they didn't log on? But they said they just couldn't log on or their internet wasn't working. So there are lots of issues that we have at looking at the attendance data from the last school year just because of all the complications of remote learning and trying to take attendance during that process. But we have that data.
I had a discussion recently with a professional from Bluefield State College, and it centered around the fact that ACT data was sort of waived because they were concerned that the number of students that would be having to be enrolled in remedial could be quite substantial. Does the state follow any of that?
Well, in our summative assessment data, the SAT data we have available from this past year, and we do get assessment scores and information as a state from both ACT and SAT for students who take it outside of the SAT school day test. So we do have that data, but there were less students that took the ACT in 2020 and 2021. I think for a large portion of that time, there weren't even testing sites open to take the test. So we do have fewer students that took that assessment during.
That would be interesting data to see from the colleges to see, what remedial classes were required, because of the lost school time, the lost classroom physical in the classroom. And you've done such a great job answering my questions. I had a few more, but I will just ask this one in the interest of time. Can we expect some kind of summative report academically and just let us know how our students did statewide or county by county in some cases?
Yes, I'm looking at the deputy. That actually comes out of our teaching and learning division, but I think, yes, if you
Perhaps she could
Want to
address the
report on that?
question, Madam Chairman?
I'm happy to let her come and speak if she feels she needs to, but I think the answer is that, yes, we will be getting that information at the appropriate time.
Okay. Thank you very much for your time.
You're welcome.
Thank you. Are there further questions? Delegate Matsoshi?
Thank you, Madam Chair. Thank you for being here. I just want to understand, did the boards have to have a mask mandate for all children in order to get this CARES money?
No. As I said, they have to have a reentry plan posted for the public. The reentry plan has to address the 6 mitigation strategies in the CDC guidance, but the option of how they address those with relation to masking or any of the other items on there is a local decision. So basically, they have to say what they're doing with masks in that publicly provided document, but it doesn't tell them what they have to say they're doing with masks.
All right, thank you.
Thank you, Delegate. Delegate Thompson?
Thank you, Madam Chair. I don't know how to work these over here. Thank you for being here. You mentioned earlier that some of the funding could be used for staffing. One of the concerns I have at my school, my district, is a lot of older teachers have been saving their days, for retirement, so they can purchase years. They can also use them for health care insurance. I can't. But they want to, save those. And a concern that many are currently discussing is that if they are forced to quarantine now, we have to use our sick days. And many have said if they're forced to quarantine, they're just going to retire. And at my school, we're running basically on retired subs, and we're running on uncertified teachers because of the teacher shortage at my school and in my district. Is there anything that could be used in this funding or directive from the department that would maybe alleviate some of those fears that can, to possibly prevent, further vacancies in the classroom?
The funding can be used for the substitutes that are required, but when, under the CARES Act, there was the issue of COVID leave, and that expired. So when that expired, the ability to use these funds for that expired too. But you can still use them to pay for the substitutes.
So, okay, so whenever that deadline expired, the funding that was still in place, you're saying could not be used?
Well, the funding wasn't only for that. So the funding is one big pot of funding, and the school system can use it for any of the items in the bulleted list. But when the COVID leave expired, then the ability to use any of your funding you had for that expired. So you could use it for that up until the date that that rule expired.
All right, so that answers my question. Thank you.
Thank you, Delegate. Are there further questions? Delegate Walker?
Chair, so you said that there was an application process through the school systems. What was that application process? What was the deadline of when those applications needed to be turned in? How many school systems were denied? What was the time period where they could reapply, and could they reapply?
Okay, so each column in those spreadsheets had an application, and they all had a different deadline. We don't deny them funding. Sometimes we have to return an application because they didn't have something in there that they have to have for compliance. So there's a process sometimes of going back and forth until they get an application that meets all of the compliance. But the funding is guaranteed to them. So the time frame between us receiving the funding and them getting their grant award is just relative to them getting an application that's approvable. So it checks all the boxes of the federal government's requirement. Routinely, counties don't meet deadlines, but that doesn't make them lose their money. We've never held their money. We sometimes prod and push because we want them to get access to the funding, even if they haven't met the deadline. There are a few items that you'll see a blank that a county didn't get an award. As I said, some of those, they received an award, but it came out of some other state source of funding in some of those columns, like a competitive grant or something. And then sometimes the county just didn't opt to apply for some of those optional pots of funding.
And as far as students with special needs, with the IDEA funding, what could they use that for? Could it be used for assistive technology, for the student to have at home, or if that student had a behavioral problem. If they broke their iPads, could that be replaced?
Yes, it can be used for anything that their regular IDEA allocation can be used for. So it has all the same rules. It is simply just like a supplement to their IDEA funding. And I will draw your attention to the fact that for all of their elementary and secondary schools emergency funding, the first bullet on every use, it includes, it can be used for any program that's already funded by the Department of Education. So it can be used to help support all your title programs, your IDEA, your Perkins, CTE programs, and so forth. So if it's a program that U.S. Department of Ed funded, they could said you could use this COVID money to provide resources that are needed to address the pandemic.
Okay. Delegate, are you done? Okay. Delegate Wormsley, did you have a question? Oh, I thought I saw you raise your hand. Any further questions? Senator from Putnam.
Thank you, Madam Chair. On page 3, on the CARES and ESSER, one of the things it says the money can be used for is working with partner organizations and nonprofits to address community needs. Do you have a list of what partners or nonprofits receive funds in order to help with this and what those funds are?
We do not have that list. That would be that the districts worked with their community partners, and so we did not collect a list of what partners that they were working with. But they could certainly provide funding support to, they may have community partners that helped them deliver food or get food out to students during school closures. If they had other partners that helped, community-based organizations that helped, they could fund them with this.
So the money would have been block granted to the county by the amount that you show us on here, and then they had liberty to choose within those categories?
Yes.
Okay, thank you.
Thank you. Delegate Tully.
Thank you, Madam Chairwoman, and thank you, Ms. Perkey, for being here. I have a question regarding the grant funding process that you mentioned and the approvability of applications. Does the State Department provide technical assistance to counties that may be struggling with those application processes to ensure that they do meet the criteria, hopefully, to get the funding?
Yes. As I said, that's a back and forth process. They submit, we review, and the platform that we use, we give them the comments back of what needs to be fixed to make it compliant. And it goes back, and it's just a matter of how closely they pay attention to the details to get that approved.
So you do coach them through and make sure that they have every opportunity to receive that funding?
Yes.
Okay,
yes, it is our goal to get all of them approved and out the door so that they start drawing down the funds.
I could certainly see where there certain counties may struggle with having someone that is competent or skilled in grant writing, so I think that is very important. Thank you very much.
Yes. And if I may add, we encouraged counties because this is a lot of funding, and many of them, their finance offices are very small. So, they are processing all the normal finance stuff, and then they're processing all of this money. They're dealing with all the payroll changes that come from the issues related to COVID. So that is why some of them can't meet deadlines as quickly, because they have very small staff, and we encouraged them if they needed to, they could add staff to their finance office to help keep the flow going for this funding to get spent.
Thank you. Are there any further questions? Well, I really appreciate, that was a lot of questions you had to answer, and thank you so much, and like everyone said, thank you for this written report.
Yeah.
We have one final business. The committee was requested to allow a presenter to make an announcement of the junior college. Please start by introducing yourself.
My name is Chad Callan, and I represent West Virginia Junior College, and I want to thank you all for allowing me to address you today about the severe nursing shortage that we have in our state. West Virginia, like the rest of the nation, is facing a severe shortage of nurses, and this is particularly severe in rural parts of the state. Since we opened our doors in 1892, we have been providing workforce training to areas like the healthcare field. And today we continue to fill that need by doing our part to address the nursing shortage in rural areas of the state. Currently, we are training nearly 300 future registered nurses, but still there's more that we have to do. And so in the past 2 years, we've been investing time to develop a first-of-its-kind nursing program for this state, which is dedicated to training registered nurses in rural areas of West Virginia. Next month, we are going to launch an accredited, accelerated, hybrid online nursing program. And this program will open opportunities for 19 rural counties and benefit over 400,000 West Virginians that are living in those rural counties. This program is accelerated, meaning that students are not going to have to go to school for 4 to 6 years to become a registered nurse. In just 18 months, they will be able to be prepared to sit for the licensure exam to become a registered nurse. This program is hybrid, meaning that portions will be delivered virtually right into the students' homes, so that students who are eligible do not have to uproot their families to go where education exists. The program is flexible, meaning that it fits the life circumstances of non-traditional students who have to work, care for their families, and manage other life responsibilities. And this program is collaborative. We have affiliations with hospitals all across the state, from the largest hospitals like WVU's Ruby Memorial Hospital and CAMC here in Charleston. But now we have affiliations with many rural hospitals in the rural communities where some of you represent. They include hospitals like Davis Medical Center in Elkins, Stonewall Jackson Hospital in Weston, Roane General Hospital in Spencer, Logan Regional Medical Center in Logan, and Greenbrier Medical Center in Ronceverte. Unlike most affiliations for nursing programs, this collaborative effort runs even deeper, and that it's including a sharing of physical, technological, human, and intellectual resources. And lastly, and maybe most exciting, this program is mobile. To meet the needs of this unique program, we have custom designed a mobile nursing lab that is the first of its kind in this state. It's equipped with 2 simulated patient care rooms containing adult, obstetric, and pediatric high-fidelity simulators. It has advanced technologies for recording and reviewing student practice, and its own internal cellular internet network, including much more. This mobile lab is staffed with a simulation technician and 2 nurse educators. It will travel around to these rural communities across the state to provide this advanced training that is necessary for quality nursing education but does not currently exist there. But additionally, we're also making the lab available to rural healthcare facilities so that their current workforce can benefit with the continuing education that it could provide. You know, people from rural communities have a great sense of pride in their heritage. They don't want to leave the communities that they live where generations of their family have lived. But because of a lack of access to education, they're often forced to leave these communities, and unfortunately, when they do, they often don't return. And as a result, these rural communities that need the benefit of their training, they don't get it. Well, this model, this innovative model of delivery, will now bring the education in nursing to these communities so that these students can stay in the communities they love, not just for their training, but also for their professional careers. We believe that this program will be transformative for these rural communities. It will provide access to nursing education, creating higher paying job opportunities, resulting in more local spending, thus having a positive economic impact. There will be more nurses in these communities that will result in better health care and a higher quality of life. And finally, there is likely to be a generational compounding effect. Many non-traditional students are the first in their families to go to college. And rural community families have a higher proportion of families without a college education. And so this type of program has the potential to help break the cycle of poverty and dependency in these communities, and that, ladies and gentlemen, is truly transformative. So in closing, I think it's important to note that with many competing demands on public taxpayer dollars, adequate funding for public workforce training will always be a challenge. The public workforce training system cannot be all things to everyone, but forward-thinking public policy will leverage private workforce training system to maximize 21st century training opportunities in West Virginia. Thank you for your time, and I'll take any questions if you have them. I do also want to note that the state-of-the-art mobile simulation lab is available for tours today and tomorrow. It's at the North Circle, and we encourage you to join us. Thank you.
Thank you so much. We don't really have time for questions, but I am so grateful for what you guys are doing, and really exciting. I hope I get to see the lab myself. Okay, seeing that there's no further business, I will recognize the Vice Chair for a motion.
Madam Chair, I move we adjourn.
Motion is on adjournment. All those in favor, say aye. All those opposed, say no. The ayes appear to have it. Have a great afternoon.